Fundamentals of Nursing HESI quiz with answers. Question 1. Which of the following scenarios represents nursing malpractice? The nurse administers penicillin to a patient with a documented history of allergy to the drug. The patient experiences an allergic reaction and suffers cerebral damage due to anoxia. The nurse applies a hot water bottle or a heating pad to the abdomen of a patient with abdominal cramping. The nurse assists a patient out of bed with the bed locked in position. The patient slips and fractures his right humerus. The nurse administers the wrong medication to a patient, resulting in vomiting. This error is documented and reported to the physician and the nursing supervisor. The correct answer is A. Question 2. Which of the following signs and symptoms would the nurse expect to find when assessing an Asian patient for postoperative pain following abdominal surgery? Decreased blood pressure and heart rate and shallow respirations. Quiet crying. Immobility, diaphoresis and avoidance of deep breathing or coughing. Changing position every 2 hours. When assessing postoperative pain in an Asian patient, cultural considerations must be taken into account, as many Asian cultures emphasize stoicism and may avoid overt expressions of pain. Question 3. A patient is admitted to the hospital with complaints of nausea, vomiting, diarrhea and severe abdominal pain. Which of the following would immediately alert the healthcare provider that the patient has bleeding from the GI tract? Complete blood count. Quiac test. Vital signs. Abdominal girth. A positive Quiac test is used to detect the presence of occult hidden blood in the stool, suggesting bleeding from the gastrointestinal tract. Question 4. What is the correct sequence for assessing the abdomen? Tympanic percussion, measurement of abdominal girth and inspection. Assessment for distension, tenderness and discoloration around the umbilicus. Percussion, palpation and auscultation. Auscultation, percussion and palpation. The correct sequence for assessing the abdomen is auscultation, percussion and palpation. Question 5. What do high-pitched gurgles heard over the right lower quadrant indicate? Increased bowel motility. Decreased bowel motility. Normal bowel sounds. Abdominal cramping. High-pitched gurgles heard over the right lower quadrant are a typical finding of normal bowel sounds. Option C. Question 6. For abdominal inspection, in which of the following positions should a patient be placed? Prone. Trendelenburg. Supine. Side-lying. Supine is the correct position for abdominal inspection because it allows for optimal visualization and assessment of the abdominal wall contours and any abnormalities. Question 7. For a rectal examination, the patient can be directed to assume which of the following positions? Genupectoral. Sims. Horizontal recumbent. All of the above. For a rectal examination, patient positioning is crucial for optimal access, visualization and comfort. Question 8. During a Romberg test, the patient is asked to assume which position? Sitting. Standing. Genupectoral. Trendelenburg. During a Romberg test, the patient is asked to stand with feet together and arms at the sides. Question 9. If a patient's blood pressure is 15,096, what is his pulse pressure? 5496. 150, 246. Pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure. Question 10. A patient is kept off food and fluids for 10 hours before surgery. His oral temperature at 8 a.m. is 998 F 377 C. This temperature reading probably indicates infection, hypothermia, anxiety, dehydration. A patient being kept off food and fluids before surgery can lead to dehydration. Question 11. Which of the following parameters should be checked when assessing respirations? Rate, rhythm, symmetry, all of the above. When assessing respirations, it is essential to evaluate the rate at which breaths are taken, the rhythm of breathing patterns, and the symmetry of chest expansion. Question 12. A 38-year-old patient's vital signs at 8 a.m. are axillary temperature 996 F 376 C, pulse rate 88, respiratory rate 30. Which findings should be reported? Respiratory rate only, temperature only, pulse rate and temperature, temperature and respiratory rate. The axillary temperature of 99. Question 13. Which of the following is not a cause of tachycardia? Fever, exercise, sympathetic nervous system stimulation, parasympathetic nervous system stimulation. Tachycardia is an increased heart rate, and it can be caused by various factors such as fever, exercise, and sympathetic nervous system stimulation, all of which tend to increase heart rate. Question 14. Palpating the midclavicular line is the correct technique for assessing baseline vital signs, systolic blood pressure, respiratory rate, apical pulse. Palpating the midclavicular line is the correct technique for assessing the apical pulse. Question 15. Which pulse's absence may not be a significant finding when a patient is admitted to the hospital? Apical, radial, pedal, femoral. The absence of the pedal pulse may not be significant if the patient has poor peripheral circulation or if the healthcare provider is focused on other pulse points. Question 16. Which of the following patients is at greatest risk for developing pressure ulcers? An alert chronic arthritic patient treated with steroids and aspirin. An 88-year-old incontinent patient with gastric cancer who is confined to bed at home. An apathetic 63-year-old COPD patient receiving nasal oxygen via cannula. A confused 78-year-old patient with congestive heart failure CHF who requires assistance to get out of bed. The correct answer is B. Question 17. The physician orders the administration of high humidity oxygen by face mask and placement of the patient in a high Fowler's position. After assessing Mrs. Paul, the nurse writes the following nursing diagnosis: impaired gas exchange related to increased secretions. Which of the following nursing interventions has the greatest potential for improving this situation? Encourage the patient to increase her fluid intake to 200 ml every 2 hours. Place a humidifier in the patient's room. Continue administering oxygen by high humidity face mask. Perform chest physiotherapy on a regular schedule. Chest physiotherapy is the most effective intervention in cases of impaired gas exchange related to increased secretions. Question 18. Which deficiency is most commonly seen in individuals with alcohol use disorder? Thiamine, riboflavin, pyridoxine, pantothenic acid. Thiamine deficiency, also known as vitamin B1 deficiency, is the most common vitamin deficiency seen in individuals with alcohol use disorder. Question 19. Which of the following statements is incorrect about a patient with dysphagia? The patient will find pureed or soft foods such as custards easier to swallow than water. Fowler's or semi-Fowler's position reduces the risk of aspiration during swallowing. The patient should always feed himself. The nurse should perform oral hygiene before assisting with feeding. The incorrect statement is that the patient should always feed himself. Question 20. To assess the kidney function of a patient with an indwelling urinary Foley catheter, the nurse measures the hourly urine output. When should she notify the physician? Less than 30 ml. 64 ml in 2 hours. 90 ml in 3 hours. 125 ml in 4 hours. Notifying the physician is necessary when the urine output is less than 30 ml, as it indicates impaired kidney function. Question 21. Which of the following substances increase the amount of urine produced? Caffeine-containing drinks such as coffee and cola. Beets. Urinary analgesics. Kaolin with pectin kaopectate. Caffeine-containing drinks like coffee and cola. Option A act as diuretic substances that promote diuresis, increased production of urine. Question 22. A male patient who had surgery 2 days ago for head and neck cancer is about to make his first attempt to ambulate outside his room. The nurse notes that he is steady on his feet and that his vision was unaffected by the surgery. Which of the following nursing interventions would be appropriate? Encourage the patient to walk in the hall alone. Discourage the patient from walking in the hall for a few more days. Accompany the patient for his walk. Consult a physical therapist before allowing the patient to ambulate. The rationale for the correct answer and incorrect choices is as follows. C. Accompany the patient for his walk. This is the correct choice because despite the patient appearing steady and having unaffected vision, he is still in the early postoperative phase, only 2 days after head and neck cancer surgery. Question 23. A patient presents with an exacerbation of chronic obstructive pulmonary disease (COPD) characterized by shortness of breath, orthopnea, thick tenacious secretions, and a dry hacking cough. An appropriate nursing diagnosis would be: ineffective airway clearance related to thick tenacious secretions, ineffective airway clearance related to dry hacking cough, ineffective individual coping with COPD, pain related to immobilization of affected leg. The patient's symptoms of shortness of breath, orthopnea, thick tenacious secretions, and a dry hacking cough all point towards a potential airway clearance issue. Question 24. When discussing hair loss with Mrs. Lim, who begins to cry, the best response would be: don't worry, it's only temporary. Why are you crying? I didn't get to the bad news yet. Your hair is really pretty. I know this will be difficult for you, but your hair will grow back after the completion of chemotherapy. When a patient is emotionally affected, it is essential to acknowledge their feelings while providing reassurance and information. Question 25. When is additional vitamin C not required? Infancy, young adulthood, childhood, pregnancy. Vitamin C requirements are increased during infancy, childhood, and pregnancy due to growth and development.